Welcome everyone to Chronic Courage today. We have an extra session today. Thank you all for tuning in. I am going to look at both screens today. I'm looking at Facebook and YouTube and Instagram. So bear with me. So today's session is usually Amber and I. So Amber had an emergency, so we're still going to go on with it and just hold space for Amber for everything to work out in her favor. So before we get started, let me first do this. As you all know that we're always going to do this. Thank you everybody who's tuning in on Facebook, YouTube, and Instagram. You guys are amazing. I appreciate you being here. So let's do this disclaimer. So the information provided during Chronic Courage podcast and live events are not meant to be used as a substitute for professional advice. You all know you need to check with your doctor for anything that we talk about here. Hold on, let me welcome everybody. So the information provided and presented is for educational purposes only. Please check with your own physician before changing anything in your treatment plan. The information contained in any video or live event is not intended to recommend the self-management of health problems or wellness. No information presented should be used by any attendee to disregard medical and/or health-related advice or provide a basis to delay consultation with your personal physician. So make sure that you are accessing this information with full responsibility for the use of the information and understand and agree that Lupus in Color and its presenters are not responsible or liable for any claim, loss, or damage arising from the use of this information. I have to put that disclaimer out there, guys, because I want to make sure that you understand that what we do is really to give you some insight as to what's going on. And especially since this is a question answer type period, I want to make sure that you understand that what we say here is just for educational purposes. And if you have any issues, don't use any advice from the internet. Talk to your doctor and make sure that you communicate with them and you work with them on your treatment plan. So welcome. I'm so glad you all are here. Welcome, everybody. I see people are on from where we have from Philadelphia. We have someone on Instagram from Austin. Thank you, everybody, for tuning in. So let's just get right to it. What questions do you have that you need to get some answers for? What questions or concerns that you might have that you think we can give you some insight on? The worst thing that I found when I was diagnosed with lupus was I had nobody to talk to. And that's what prompted me to start Lupus in Color, because I had nobody to talk to. Nobody looked like me. Nobody knew anything about lupus when I got diagnosed. I don't know what the issue was. I didn't see anybody who was like me. You know, lupus primarily, affects African-American women, Asian descent, Hispanic descent, but I didn't see those type of people. So I needed somewhere to go that I would be able to get some answers. So I started to do some research and started to do everything that I could to find information about how I could go and deal with lupus. So let's see. We have a question on, what is this, Instagram. Apparently my lupus is the worst any consultant has seen from Northern Ireland. I'm sorry to hear that. What are they saying? Why do they say that it's the most difficult one? And y'all, like I said, bear with me because I'm doing two different things at one time. So someone actually stated on Instagram that her lupus is the worst that the consultants have seen in Northern Ireland. Thank you for tuning in from Northern Ireland. What's going on? Tell me in the comments what's going on and why they said that. On Instagram again, How did you start advocating? So that's a good question. The way I started advocating is because I didn't know anything about lupus. So I started to do my own research. And then I got to the point where I was like, nobody else should feel this way. Really. Nobody else should feel the way that I felt, lost and confused. So I said that I needed to create something that took care of that and that would help other people like me not to be confused and not to be so discouraged in their fight. And that's how I started advocating. Rashawn is from Dublin, Ireland. Oh, you're in Dublin, Ireland. Wow. I hope you're having a good time. Let's see who else has something to say. Thank you for this. A loopy in denial at times. It's okay. Sometimes we go, you know what, Lorena, we go through different stages in our lupus fight. We really do. We have this grieving period often as we deal with lupus. And one of those issues in that grieving period is denial. And that's fine because look, it's hard to deal with lupus. So it's okay that you go through those stages every now and again and make sure that you understand that this is just a stage and it's going to really be better in due time. I don't want to say that, this too shall pass. I don't really like that statement too much because it kind of dismisses what you're dealing with. But know that you have overcome 100% of the things that you thought that you couldn't. So in that denial, you have to go through all of that denial, bargaining, and then actually come to some acceptance that, okay, I have some issues going on and I really need to start addressing them so that I'm not in this denial and go into a depression. So that's a great statement. I appreciate your statement. Let's see what's going on Instagram here. I was diagnosed with MS in 2004 and then diagnosed with lupus in 2017. It has been very hard to determine if the symptoms are related to MS or lupus. I've heard that from people who are diagnosed with both MS and lupus. I think the young lady that I talk to often, she states that the MS is more nerve pain, almost like fibromyalgia, almost like really nervy. And lupus is more of a harder pain, so to speak. I don't really know how she distinguishes the two. It's hard to distinguish the two. Just like if you have comorbidities, it's so hard to deal with the different avenues and different symptoms from all of it. Because I have lupus, I have type 2 diabetes, I have rheumatoid arthritis, and a possible Sjogren's. So it's hard to determine, okay, is this lupus? Is this diabetes? So I think if you're working with your doctor, then you can figure out like, okay, how is my body working? And if you're keeping a journal, it makes it even more easier so that this happened this time, it felt like a nerve pain. This happened this time, it felt like a joint pain. So you can tell your doctor and really, balance it all out so that you understand which pain is which. Beth says, hi, from southeastern Georgia. Hello, I'm 56, and my question is, does anyone else have shortness of breath and lymph nodes swollen in their chest? If anybody else has that, put it in the comments, and I will answer her. I've had shortness of breath before, Beth, but it was because of double pneumonia and pleurisy. So you might want to make sure that you talk to your doctor about that shortness of breath. Some medications can cause that shortness of breath and swollen lymph nodes, but I would really check with your doctor because those are serious issues and you definitely want to get that taken care of and make sure that it's nothing serious. So if someone else has those issues, please let me know. Another question we have is, I'm having the most issues with remembering things. Oh my gosh, that brain fog will really mess you up. Here are my tips for brain fog and remembering things. And I'm going to tell you, I still forget things even when I do this. Sometimes it's just what it is. You know what I mean? My number one tip is to get you some sticky notes. Sticky notes or paper, or since you're always on your phone, put an alarm. make sure that you are writing it down. Make sure that you are repeating it to yourself so that you're not forgetting. Now, like I said, it works most times, but sometimes it doesn't work. What I find is that the repetition is what makes it sink into the brain. So if you can write it down several times, put it in your phone several times, say it to yourself several times, that's how I learn how to remember stuff within a brain fog. But sometimes that brain fog is really, really bad, and you're just not going to remember. You're going to forget. Sometimes I forget my name. Sometimes I have gone down the wrong side of the street, so brain fog can really be difficult to deal with. But if it gets to the point where you're not remembering your name or not understanding things, and you're having some difficulty really remembering day to day, make sure you check with your doctor, make sure there's no CNS involvement, and make sure that your doctor understands what's going on when you're forgetting. This way you'll understand it yourself too, and you can handle it that way. Let's see what we got over here on Instagram. And y'all, this is really just a session where you can ask questions and I'll answer them as best as I can. But like always, you please check with your doctor. Don't take what I say as gold. I'll just tell you what I can tell you from my experience. Okay. Here is heart issues to mess with me. I almost coded last time I went to the ER. I'm so sorry. I'm glad that you are here, KL. I'm glad that you are here. We have so many issues that can happen with lupus: heart issues, brain issues, lung issues, all these different issues that can come up. And it's so hard to deal with. But I get so excited when someone says that I overcame that. And you're here today to tell that story. It becomes a testament. Your mess became a message. You know what I'm saying? Michelle says, hello, what's a good lotion to use for the skin? Okay, I'm going to tell you something. I use CeraVe and Aquaphor, especially if I have lesions anywhere on my body. So you all know about the lesions. You get the little red spots all over your body. I get them on my body. I'll get them in my hair, and they hurt and they itch and they burn. And I have found that CeraVe healing ointment and Aquaphor healing ointment together really help to calm that down. Now it's greasy as all get out, and it makes everything greasy, but it works for me. I also, when I bathe in cool water, or if I take a shower, I bathe in cool water, and I use Aveeno moisturizing soap with the Rain. I forget the name of it. Oh, I'll find the name of it. But I use those two products that my dermatologist put together, and it really helps to keep those lesions down and to help the skin to just be a little more moist and things like that. Because my skin gets so horrible from lupus and from diabetes. So it's hard. So, but start with the CeraVe and the Aquaphor. And someone on KL just said that ointments are the best though. So the healing ointments work for me. It might not work for you, but try it out. You just never know. Let's go on to the next question. Let's see. Aaron. Hi, Aaron. Thanks for tuning in and thanks for commenting. I love that you are doing this live. Thank you. I'm newly diagnosed and just started getting a dry cough. Is that normal? A normal lupus thing? Does it get better? It depends. I don't know if that's a normal lupus thing, because everybody, even though lupus is the same disease and everybody, it manifests so differently. When you say newly diagnosed, like very recent or a year, let me know that. And let me know what type of medications you want, because some medications can get that cough in. And then I can tell you from there. I'm not sure if anybody else has that cough. I know some medications can cause a cough. And if you're having some lung issues, it can cause a cough. So give me some information, like how long you've been diagnosed, what medications you're on, and what your doctor has said about it. And then I can help you a little bit better. Hey, Stacy from Trinidad. Thanks for tuning in. Um, I'm gonna say a rare diamond. I like that name. Does anyone suffer from severe ringing in the ears? I have ringing in my ears. I have issues with a lot of wax buildup, but I think it's called sinusitis, where you have the ringing in your ears. Definitely talk to your doctor about that because they can tell you what you can use to possibly limit the amount of ringing that you have. But ringing is very common for me, and I know that for many other lupus warriors, that ringing is something that's very common. So, thank you for your question. Let's see. Let's go here. Diana says, does anyone get sensitive to touch on the top of their head? Yes, 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 yes. I have, okay, at the crown of my head, I guess my hairdresser said it's the stress area, but my hair is a lot shorter at the crown of my head because I get so many hot spots or lupus lesions at the top of my head, and they hurt, and it's hard to comb my hair, and I lose my hair in the middle. I haven't lost it down to the scalp, but like my hair will be long hair, and then directly in the middle, right where this bun is at, probably because I'm wearing a bun, I don't know. It will get hot spots, and it hurts, and it's sensitive to the touch. And when that happens, I literally don't do anything with my hair. I wash it. I let it air dry. I don't put heat to it. I don't really comb it as much. And if I do, I use a soft brush so that, number one, I don't strip the hair out. And number two, I don't hurt myself because it hurts. So if anyone else has that problem, please put it in the comments and I'll put it up for her. Let's see what we got here. What we got here. Thank you guys for all your questions. I so appreciate you all being here. Hi, Kendra. Nice to see you here. Rashawn says from head to toe. I'm not sure what you were referring to, but I'll get back to it and I'll figure it out. Beth said that she stays tender on my head and gets bumps and itches. Yeah. I think that's a definite symptom of lupus, and then when you get those bumps and when you get those lupus lesions in your head, make sure you're writing that down. Write down like what you ate, write down like what you were doing, where you stressed, so that when you go to the doctor and you say to the doctor, look, I've had this hotness on my head, I've had these lesions, I've had these bumps, and this is what I did. What is it something that I can do different that makes them go away? And ask him those questions. The most important part with your symptoms is to really write down things that happen and what you've been doing. This way, you know if it is something that lupus is just going to come, or if it's something like if I eat red meat, I get a lot of inflammation in my feet. So I know if I ate a burger and my feet are swollen, I know why it's doing that, because every time I eat red meat, that happens. So you want to make sure that you're journaling everything so that you understand your own body, number one, and so that you can tell the doctor, this is what's going on and this is what I did about it. So make sure you're doing that. And that, you don't have to make sure, but look, it helps me. One thing that helps me is the journaling, and that's why we do journaling on our site. That's why we do a lot of these things, so that you become habitual in what you're doing. So if you're writing in a journal for 30 days, it should become a habit, right? And I'm not saying that you have to pour your life out in those journals, but you do have to write down what you're eating, write down what you're drinking, so that you can see if your food is messing with you, if it's causing some inflammation, because all of us are different. Garlic might be okay for me, but it might be bad for you. You know what I mean? So you want to make sure that you're keeping a log of things so that you can learn your body. It helps. Diana said when her head gets too sensitive to touch, she usually gets a flare. That's interesting, because now you know that when that happens, a flare is coming. And that's getting to know your body. The important thing is learning your own body, because everybody's going to be different from what you have. Let's see. A good goat milk soap is good for your skin. Thank you. Never thought about that, Diana. So if you're having issues with your skin, Diana has said that a good goat milk soap is good for your skin. Tell us how, Diana. Write that in the comments for me so I can relay that to everyone else. The cough question, just FYI, what really kept getting me at first was heart and bronchitis. Okay, so someone had asked about the cough, the dry cough. KL on Instagram stated that the cough question, just FYI, what really kept getting me at first was heart and bronchitis. So, you know, you might want to talk to your doctor. Maybe it's bronchitis, maybe it's some type of, issue with your medications, but that's a great point. Some people manifest it with the heart and bronchitis. So thank you so much, KL. Q Test says oatmeal baths too. You know, just like if you had poison ivy. So use those type of things to help you get through those tough skin patches. Oatmeal never worked for me, but for some people, like for Q Test, it has helped. So try oatmeal baths, try your ointment, try whatever you can that doesn't have, like steroids in it. Because when you have the steroid cream, sometimes you're going to have to use the steroid creams, but the steroid creams will definitely lighten your skin in the places that you're using it most. So just be aware of that when your doctor gives you any type of steroid cream. Let's see. Hester Lang says, I have DLE and SLE and I'm losing my hair as well. I'm sorry to hear that. Losing your hair is such a rough thing. I've cut my hair very short many times, and you know what? I had to get to the point where it's just hair, and it'll grow back once I get healthier. And although that doesn't make anybody feel any better when the hair comes out, it's actually kind of scary. It's scary to comb your hair and have clumps of it come out, or it's scary to have the edges of your hair, come out in your hand when you move your hand over it. So I understand that that's a difficult thing to deal with, but you know what? There are so many cute little short styles out there. And when my hair starts messing up and I can't handle it, I cut that joint off. I don't even care. Not anymore. I used to care a lot about my hair and oh my gosh, I'm going to lose it. And you know what? If I go bald, just call me the cute bald girl. It is what it is. It gives me a reason to be nice and cool in the summer and cover up in the winter. So I know that that's a difficult thing for a lot of people to deal with, is the hair loss. Let's see. Yes, it's awful. Yes, I'm also allergies. Oh my gosh, let's not talk about the allergies. I feel like allergies are horrible this year. And it's probably because we had such a mild winter. I'm in the northeastern region, so I'm in Virginia, so we haven't had any real snow in like I want to say 2 years. So with that, we get this pollen already in March. So the allergies definitely can mess with you. Hey, Nina, nice to see you. Thanks for walking with us. I appreciate you and your husband. You guys are doing a great job. Let's see, what else do we have? Let's see, any other questions or any other comments? Does anyone have large bumps on head? We discussed this a few minutes ago, Linda. Some people have had some lesions on their head. Some people have small bumps, but if you're getting large bumps on your head, please go to your doctor and make sure that you are talking to your doctor about those bumps, and make sure that they're bumps, they're not lumps, and see your dermatologist so that she can really look at it, maybe biopsy it, and make sure that it's nothing serious. Let's see what else we have. Erin says she does. She has them right now. She has alopecia though. Yeah, and that's the thing. We want to make sure that we are checking with all of our doctors. And I know it's a pain in the behind to go to different doctors. You have your rheumatologist, you have your primary care, you have your cardiologist, your neurologist, your dermatologist, all these different people that we have to see. But it's important for us to see these people in order to make sure that we're getting the proper care for ourselves. It's hard enough to deal with lupus. It's even harder when we don't have the answers. So the doctor can give us an answer and can help us and let us know, what's going on. Stacy said garlic is a trigger for her. Absolutely. A lot of people have told me that garlic is a trigger for them. I don't think it's a trigger for me. It hasn't done anything to me really, but it could. Our bodies change every single day. And with lupus, it's just everything is so unpredictable. So you have to be kind of real diligent in how you're, marking down your food and things of that nature so that you know what's going on with you. Let's see. Hersterling said, I have just started biology, so I hope that helps. Hey, being in a biology class will definitely help you to understand your body, but it also might scare you. So just be prepared and make sure that you're not internalizing all that you're learning. I know for me, when I first got diagnosed, especially when I was first looking, on the internet and stuff like that, I was like, oh my God, I'm dying. I have it all. I have everything. I think I have this. I think I have that. So just as you're learning, just don't internalize that so that you can be okay with it. I think a lot of people have this. Does anyone have problems with his or her kidney functions? Yes. That's a main issue for many lupus warriors. I was just put on another medication so that I can really keep my kidneys safe. I know there are some people on here that might have lupus nephritis, and maybe on dialysis. So a lot of people with lupus can deal with, kidney issues. And you definitely want to make sure that your doctor is aware of everything and follow the doctor's orders so that you're not having more issues with your kidneys. This is a good question. Linda says, how do you all get people to realize how bad stress is on you? I don't think people ever really realize how stress can play a role in your illness. And I'm going to tell you honestly, Linda, I think the only way people really understand is when you're sick. I think my family was in denial for quite some time until I really, really got sick. And the doctor explained to them that it was stress and, you got to limit the stress and everything like that. So you have to really just talk to your family, talk to them honestly, and don't hide when you're stressed out. I tell people, I've told my sister this before she passed away, you're making me physically ill. And I know that sounds bad, but it's the truth. You're stressing me out to the point I'm getting physically ill, and I tell people all the time, when I pull away, excuse me, y'all, when I pull away, it's probably because I'm stressed out and you're making me physically ill. You know what I'm saying? So don't be afraid to be honest with your family, with your friends, and let them know, stress is horrible. Stress can kill you, even if you don't have lupus. So imagine your immune system going haywire and your stress. So if stress can kill a healthy person, and you can tell them that stress can kill a healthy person, what do you think it's going to do to me? It don't have any respect of persons. It can kill me very quickly. Stacy says support and learning more is key. Absolutely. Oh, you were on biologics. I got you. I'm on Ben Lister, so I understand that. Pretty gam. I like that. It's cute. I have had to cut out stressful situations out of my life, which includes family and friends. Hey, let's say it again. Sometimes you just got to cut these folks out your life. And it might be, I hate to say it might be your husband, it might be your kids, it might be, and it's hard to cut out your husband or your spouse or your wife. It's hard. But you have to be a person who protects you. And in doing that, sometimes you just have to say, you know what? I can't discuss this with you anymore. You're not understanding what I'm going through, and I won't stress myself out trying to explain it to you. Excuse me, this little fan is getting in my throat. Okay, let's see. What else do we have? Nina says, does anyone get bad hand and leg tremors out of the blue? I used to. As a matter of fact, today I had a little tremor in my thumb, but I think that was because I was holding something heavy, and I have RA as well, so it kind of like just made my hands just tremor and drop stuff. But the tremors, from my understanding, can be some type of CNS involvement sometimes. So just make sure that you're telling your doctor that you're having tremors, and make a note of how many tremors you're actually having per day. Is it a heavy tremor, or is it something that is very light? Make sure you're writing it down so that when you go to the doctor, you can say, once again, Doc, I had these tremors Tuesday, Wednesday, and Thursday. Thursday was the worst. I dropped a glass. I couldn't open a door because my hand was tremoring so much. So if somebody else has those tremors, let us know in the comments. Let us know in the comments. Okay. So people, yeah. Look, it is the first day of spring. I'm going back to the comment about cutting people off. Sometimes you just have to, how a tree just drops those leaves and they let that leaf go, and next year that a new leaf arises. So sometimes you just have to let those people go, or minimize your discussion or talk with them, because sometimes you're not just going to leave your husband because you don't understand, or you're not going to leave your wife just because she doesn't understand, although some people do. You're going to try and discuss it with them and get them to try and at least have some empathy for you. So sometimes limiting what you say to people and how you let people know about your lupus, because you know what? Everybody should not be privy to your lupus journey. Everybody just doesn't need all of that information about what you're going through with lupus. But those closest to you might want to make sure that you're honest and open as to what you're going through, so you know how to handle them on your lupus journey. Santiago says, I may have missed this, but is anyone else on Benlysta? I may be crazy, but I feel like the samples the doctor gave me were working, but the prescription that is getting delivered does not work. I am on Benlysta, but I'm on the IV infusion, Santiago. So I'm not really sure. If anybody else is on the shots, please let us know. Over in Instagram, Teresa really needs to know. I guess that it takes a while for Benlysta to really kick in. For me, it took about 18 months. And the only way that I figured out that it was working was writing down my symptoms and noticing every little thing on my body. So when I first started taking Benlysta, my hands were like sausages. My feet were horrible. I could barely walk. I couldn't extend my arms. But then I noticed as I started taking Benlysta, because I've been on Benlysta since it first came out. You might as well say I was in the trial, because, it was very few Black people that had taken it. But when I started taking it, I didn't realize anything going on at first. But honestly, my husband started to realize little things like, oh, you know what? You're not complaining that your hands hurt. Your hands aren't swollen this morning. Little things like that along the time. So hopefully it'll start to work better. And as your body becomes more acclimated to it, it'll start to help you just a little bit better, Santiago. Someone said I had to put some people in timeout because they were stressing me out. I actually told them they were literally killing me. You have to. You have to let these people know. You have to let them know. Let's see. Angela asks, anyone get red hands and that crack and bleed? Ouch. The doctor can't figure it out. It burns and itches so bad. I have lupus and RA. I don't think I've ever had my hands to the point where they crack and bleed. Well, maybe on one finger. But the thing that you might want to talk to your doctor about is Raynaud's, and just to make sure that you talk to your dermatologist to see if there's anything that you can use. I think in colder weather, my hands get a little rough, but I haven't had them crack and bleed like that. Make sure you definitely talk to your doctor and talk to a dermatologist. They might be able to help you a little bit better than your rheumatologist can. You know, everybody, all these doctors are different specialties and they know different things. So a dermatologist might be able to help you just a little bit better. I hope that helps a little bit, Angela. Nina, mommy says, Nina Ra, I have bad tremors in both my hands. This is a great statement because this is something that it really is annoying for me. It's the incessant itch for me all over the body. Yes, 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 yes. Who said that? Santiago. That itch will have you going crazy, crazy. I've used so many different creams, so many different things. And the only thing that has helped me, honestly, with the itch is a cold shower. I have chronic hives as well. And I'm going to tell you, you would think that you would take a warm shower to, calm down that itching and everything. No, that cool shower, cold shower, if you can stand it. And if you don't have any heart issues, then you can do the cold shower. But that itching is horrible. And nothing really works. You can take some Benadryl sometimes, but nothing really works with that itching but a cold shower for me. So I don't know if you guys want to try that. Someone said, I agree. I have deleted a lot of people out of my life. This is why I don't have any friends. Hey, you got to do what you got to do to keep yourself safe. You have to keep safe on your journey. So someone was asking about the oatmeal soap. Linda says she found a great oatmeal soap by Yardley at the Dollar Tree. $1.49, but great. Look, it doesn't have to be expensive. Thank you, Linda, for that. So I forgot who asked about the oatmeal soap. But Linda says she found some oatmeal soap by Yardley. And I love Yardley. Their soap is actually pretty good at the Dollar Tree for $1.29. Thank you for that. Thank you for that. Diana, this is a great statement. For allergies, I found local honey works best. Absolutely. Get to a shop that has some local honey and it will take care of you for the most part. Unless you're like me and your body is cuckoo for coconuts and kind of holds it for a couple of weeks and then it kills it again. So, but definitely, that's a great statement. Let's see, what do we have on Instagram? Someone said Raynaud's syndrome will cause your fingers to turn blue and cold as well as causing your hands to turn red and crack. Absolutely. Absolutely. So if you're having those crack hands, like I said earlier, definitely talk to your doctor and see if he thinks that it might be some Raynaud's. Talk to your dermatologist. There are a couple of doctors that you need to have. Of course, you got to have a rheumatologist, a primary care physician. But another one is a dermatologist. You have to go see a dermatologist for those times when your skin is acting just crazy and lupus is just attacking your skin. You know what I mean? So make sure you talk to your dermatologist for that and let's get that settled so that they know what's going on. Okay, yeah, that's been listed in infusions, yes. Someone said, I look like a crackhead with the itch. Yes. That's a good way of putting it. Absolutely. Absolutely. I scratch and oh my gosh, it's ridiculous the way I look. And my husband will look at me like, okay, you just need to go get you some Benadryl or something just to take the edge off. That's horrible because you really now you sound starting to sound like a little drug addict, but hey, you got to do what you have to do to make yourself comfortable so that you're not ripping off your skin. Because literally, I can sit here and get itchy and I can start seeing my skin starting to break because I'm scratching so much. So definitely, 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 definitely. Um, oh yeah, pretty gam. People will try and tell you how to treat your lupus. Always, always. They don't even know what lupus is. They don't know what lupus is, but they want to tell you how to treat your lupus. Here, use this product. It'll cure your lupus. Do you know what lupus is? No, I don't know what lupus is. How do you know your product is going to cure lupus? Everybody tries to tell us all how to cure our lupus and what we need to be doing and why we are doing something wrong to make our lupus worse. When in all reality, they don't even know what lupus is. And those are the type of people that you just cut off. You don't even have to worry about them. You don't even talk to them. I ain't got no time for that. Ain't nobody got time for that. Ain't nobody got time for that. Angel, hey Angel, love Miss Dozier, always encouraging me and giving me great information. I love you, Angel. Thank you so much. I appreciate you. I sure do. I sure do. I love you all. Let's see. Amanda says my hair was falling out like crazy. I started taking prenatal. I've heard this before. Prenatal vitamins because I am not absorbing vitamins as well as everyone else. The doctor's okayed. My hair stopped falling out. Doctor said keep it up. You don't have to do it every day. I have heard that, Amanda. Thanks for that. Check with your doctor and see if those prenatal vitamins will help. I remember being pregnant and how flourishing my hair was on those prenatal vitamins, besides, the baby making you look absolutely magnificent on one day and absolutely horrible on the next. But I have heard that. So if you're having some issues with your hair, talk to your doctor about those prenatal vitamins. That might help you. Thank you, Amanda. Let's see what we got here. Let's see. Christina says the pain on both my legs hurts so much. What kind of pain is it, Christina? Is it a pain like if you worked out, or is it a pain like, the inside pain that you just can't describe? What type of pain do you have? Mommy says, does anyone experience throbbing headache that lasts days and even weeks? I have had some serious headaches. But you might want to talk to your doctor about those migraines and see if that's what's causing those throbbing headaches. I think sometimes the medication that we're on can also cause those headaches. Not being well hydrated, can cause some headaches. Not eating enough can cause some headaches. Sugar being high, sugar being low. There are so many different issues that can cause those throbbing headaches for days. So what I would suggest to you is to really, I'm going to say it again. I know I've been saying it all night, but keep a journal. Keep a journal of what you're eating that day, because, salt can cause headaches, lack of water and things like that. Make sure you're keeping a journal so that you can just pinpoint how that headache is coming on. And some of these things, sometimes we make it harder than we should dealing with lupus. And I don't mean that in a negative way. I really don't. There are just some things that we can do daily that can help us deal with the issues of lupus. So once we get to a point where I say more mature in lupus, and what I mean by that is that when you get so fed up with what's going on in your body, you find different ways to cope. And one of those ways that has helped me, and it helps a lot of other people, is writing down your symptoms and keeping really good records of what's going on and what you're doing with your body. And I'm not saying that I'm perfect. Nah, I'm not. Sometimes I forget to take my medicine. Sometimes I forget to journal. Sometimes I get so upset that I have lupus, because I got to take all this medication and I can't go out in the sun all day like I want to. Nobody's perfect, and we shouldn't even try to be perfect on our lupus walk. We just have to learn how to cope. Because we don't have that cure yet, we have to learn coping skills that help us day to day. Okay. Let's see. Uh-oh. What else we have here? Someone said they get those too. Amanda said, try ice packs on your neck when you have those throbbing headaches. I have a question for anybody out there. Has anyone tried acupuncture? And if you have tried acupuncture, how did it work for you? Let me know in the comments and I'll say it up, bring it up on the screen. Throbbing pains in the legs. I think I've only dealt with throbbing pains in my leg when I started working out again. Sometimes, you know what? Sometimes that restless leg syndrome, though, can kind of come on. And since COVID, we've been more sitting and, less activity. So I'm not sure if that might cause some issues in the legs. But if you're having those issues with your legs, definitely talk to your doctor about it and just find out, try to explain to him what those pains are like, because there are so many different types of pains that you can have. I hope that helps some. Let's see. Angela Taylor, yes, my skin gets super dry and it will peel and crack really deep. It's so painful. My doctor told me it's from lupus and it's caused by stress. Okay, so the cracked hands and stuff, hers was caused by stress. So I paid attention to my stress levels and have found that when my stress is really high a few days after the stress, my skin flares up and starts to crack. And that's so important to just keep a notation of what's going on so that you know your body best. When you go to your doctor, sometimes your doctor is like, no, you should do this, you should do that. And then you're saying, no, I know my body. And this is what happened. And this is why I do this, because this happens. So, you want to make sure that you're an active participant in your healthcare. Most definitely. Let's see what's IG is going on. Let's take a much good. Someone said, I've always had pain in my legs and muscle pain since my diagnosis last year. So people are we're all dealing with the same sort of thing. Some of us more than others. Haley says she has painful swelling in her legs and feet. And everything started for me in my arms and my feet. And it was hard. It was hard. It was hard to walk. It was hard to live. It was hard to deal with. These things are not uncommon. But I have to stress, I can't stress it enough. It's important for you to make sure you're letting your doctor know. I think sometimes we get to the point where we don't want them to know, or we don't want to tell them about it, or we don't want to explain it because they might feel like we're a hypochondriac. But the reality is we need to let them know. We need to let them know what's going on in our bodies so that they can treat us appropriately. And we shouldn't feel ashamed for that. You have a chronic illness. Everything's not going to be perfect. And sometimes things are going to arise that you and your doctor have to figure out. And that's okay. It's okay. You just got to be patient with yourself. You have to give yourself some grace and not think that it's your fault. You have lupus. It's a chronic illness. And you have to make sure that you are taking care of yourself and letting your doctor know what's going on. Let's see. Mommy says, my knees are down to my legs are in pain right now. It's quite annoying. Absolutely. Hi, Ashley. Nice to see you. I'm glad you're on. Thank you for tuning in, everyone. We appreciate you. Santiago says, aching in my hips and shoulders. Yep. It's almost like bursitis. It's like a bursitis pain. If anybody ever had bursitis, if you're a swimmer or something like that, it's a horrible pain. Absolutely. Let's see. Angela, stress triggers the symptoms. Try to relax and breathe for a while if you've felt that stress building up. That's very good. Very good advice. Definitely good advice. When you're stressed out, tuning into your breath is always great. That's why we do the Monday meditations. That's why we tuning into your breath brings you to the present moment. It can really help you with anxiety. It can help you with some depression. It can help you with that stress. Tuning into your breath is definitely helpful on your lupus journey. Thank you. Let's see. Question says, how do you tell the difference from feeling bad due to cold or illness versus lupus? I'm still learning my symptoms. It's just hard to know the difference since I've dealt with feeling bad for many, many years, yet just diagnosed 2 months ago. Erin, that's I treat everything like it's a lupus issue, especially early on, because you just don't know. Your body is kind of haywire when you're first diagnosed. And lupus, I've said this before, is like having a cold, the flu, getting run over by a bus, getting beat up by the mailman. It feels like everything. So especially since you're so new to your diagnosis, I would treat everything like it's a lupus issue so that you can get to the doctor and he can see. And don't feel ashamed if he goes, oh no, it's just a cold. Because look, a cold can turn into pneumonia. Pneumonia can turn into pleurisy. So you want to be safe. It's better to be safe than be sorry. So I would treat, especially if you're new to learning your symptoms, I would treat it all like it's a lupus issue and contact the doctor, explain to him what's going on, and he'll tell you, oh, that sounds like just a cold, or, why don't you come in and get a prednisone pack or something like that. But always contact your doctor, especially since you're so new to the diagnosis. Absolutely. Has anyone tried edibles and do they work? I have. Yep, sure have. Absolutely. Sometimes they work, sometimes they don't. You know what really works? The CBD oil and the cream. Sometimes I can put that on my lesions and that really helps. So, but edibles, sometimes they work, sometimes they not. I guess it depends on the strain of the edibles and what's going on in your body. I think a lot of people don't realize that all the medications are going to operate in conjunction with your body and how your body reacts to things. But some of the edibles that I've had have worked. Some of them, not so much. So I don't go back to the people that give me the ones that don't work, Let's see what we got here. We're almost done here, guys. So I'm going to keep going through. Someone said, yeah, they think that you're just saying that. I agree. Rashawn says, take permanent positive control of your life. I love that statement. Take permanent positive control over your life. And it starts with you. It starts with you doing what you're supposed to do for yourself. I know a lot of times we want the doctor to tell us what to do, but sometimes we have to take that control over our bodies and over what we do every single day with our bodies so that we understand our own bodies and we can tell the doctor what to do. Because you know what? The doctor works for us. And although he's a doctor, he knows, your body, and he knows what this might do and what that might do. You essentially know your body the best. And you can tell him whether that medication is working or whether you don't want that medication. Make it a friendship. My doctor, I could see him at the gym and he's like, oh, I'm glad you're at the gym. Make it a friendship. Don't just make it a medical professional and you. Make it a friendship. Make sure you're communicating well with your doctor and it works. Any suggestions for mouth ulcers? I have lupus Sjogren's and had full mouth tooth extraction surgery. Developed infection, of course, and many recurring ulcers. Infection is going now 2 rounds of antibiotics, but flare-ups and ulcers continue. Ulcers are so common. I get them all the time. And then I get some magic mouthwash. We talked about this last time. the magic mouthwash that you swallow. There's some that you swallow that gets rid of thrush and stuff like that. And I'll have to find the name of it and post it so that you all can ask your doctor about it. But the ulcers are really common. Thrush for me was very common, especially early on and when I wasn't eating well. But there's some magic mouthwash. And sometimes, you know what, Orajel helps, at least to numb it a little bit. And of course, you know, warm salt water and things of that nature. That's going to hurt, but it helps me sometimes. But ask your doctor about magic mouthwash. And as far as the teeth extractions, I have had a lot of teeth extractions, unfortunately. I had to switch dentists. So this dentist that I have now gave me this little, how you call it, little, like a needle. It's not a needle that goes in. It's just the one that you use to wash away debris in your mouth when you have an extraction. And I purchased a water pick where it shoots the water in order to actually do the flossing for me because my hands are so bad. And that helps with the ulcers because it keeps the mouth a little bit cleaner than I could do with myself with my regular flossing. But talk to your doctor about the magic mouthwash. That might be helpful for you. I've been on Benlysta for 7 years. Does it work every month or different month to month? It's different month to month for me. Like this month, I'm pretty good. I don't get my infusion until April 1st, and I'm pretty good. I think it depends on your body. You know, like I said, our bodies are changing every single day, and we just have to make sure that we're taking care of ourselves properly so that the medicine can work a little better than, you know, normal. Sometimes I find if I'm not drinking enough water, the medicine is not working. Or if I'm eating poorly, my medicine doesn't work as good, especially if you have comorbidities. So it works, but it'll be different month to month, just like anything else, though. The person that mentioned prenatal vitamins, were they over the counter or prescribed? Let me know in the comments. Someone asked that question. Let's see, what do we have? Oh, very good, Santiago. Thank you for telling us that. Walmart or any pharmacy will give you a 10 milliliter syringe without a needle to clean out mouth wounds. So that's a great statement. Thank you for that. He's saying, why does my skin peel and has white hard skin on my face? I'm not really sure. When you say like a white bump, or is it something different? Let me know in the comments. We have about 5 more minutes that we're going to go on, guys, because I think that they're going to cut me off on Instagram in a minute. Does anyone experience recurring burst vessels in their eyes? It's happened twice in the past 6 months. No eye trauma. It's just spontaneously happened. The only time I have I have a lot of eye issues. I'm sorry. Y'all, I got a whole bunch of stuff going on. But when that happens to me, it's usually scleritis. So I don't know if anybody else has that issue. If you do, put it in the comments. This one is on Facebook, so you might want to go to Facebook and answer her there. The eye issues that I have and have always had when I was first diagnosed, it was something that came up as well, was scleritis. And that's when the whites of your eyes become swollen. I haven't had any blood vessels burst, but the scleritis can present like that. So you might want to check with your optometrist. See, another doctor that we have to have. You might want to check with your optometrist so that you understand exactly what's going on. Definitely talk to an eye doctor so that you know that it's not something like scleritis or something more serious. Let's see. What do we have here? What do we have? I will look at your picture when I get off. I can't get to it now because I'm actually on a different account reading y'all comments. I'm sorry. I get tremors and spasms in my hands. This is a good one as well. I feel I live with fatigue constantly. Yeah, I do too. I feel like it's never ending and it comes on so quickly and it stays so long sometimes. And then sometimes, like today, I mean, I straight up was fatigued from about 12 o'clock to 1 o'clock. And then I said, let me get up and go and take a walk with the dog. And that actually made me feel a little bit better. But that fatigue is no joke, no joke whatsoever. Let's see. I take Benlysta injections. I felt great at first, but I feel at a standstill. My doctor said I need more time. It's only been 9 months. Yeah, Nina, I would say I agree with your doctor on that one. It took me about 18 months to really get some real effect of lupus. I mean, of Benlysta, and I, I, I mean, it changed my life though. It really did. And I haven't had the injections. I don't know if you would want to do infusions. I've only had infusions, and it works well for me. I said I would do infusions until my veins, can't take it anymore, and then I'll go to injections. Most people that have been on the Benlysta injections have said that it works better because you're taking it weekly. But I'm not really sure. But it does take some time for it to really acclimate your body and train your body how to fight off those, flares. I'll take a couple more questions and then I'm going to have to go, guys. Anyone try rituximab, which is Rituxim? I have been on it twice last January. It works great on me. I have to do it again next year, but it doesn't make you safe from bad flare. Just lessons. Yeah. I mean, I've never tried Rituxim. When I first got on Benlysta, we were trying to get it, but my insurance wouldn't cover it. And that's a whole nother issue, right, y'all? Insurance not covering things and the doctor has to fight for you. That's why it's so important for you to have a good communication with your doctor. But yeah, sometimes it takes some time for this medicine to work on us, whether it be Rituxan or Benlysta or the new Safenlo. There are so many new drugs that are coming out to help lupus warriors just live a normal life. I don't think any medication that is on the market will stop flares fully because it's lupus and it's unpredictable. But the whole point is for it to lessen your symptoms and help you just live a more normal life without the pain that comes with lupus. Let's see. Let's go through a couple of more, and then we're gonna have to say good night because it's getting late. It's 8:03. We've been on here for an hour. Y'all listening to me talk. Oh Lord. Trina says, first I want to thank first I want to say this platform has helped me in understanding that I'm not alone in this fight. So thank you. Oh, you're quite welcome. I'm so happy that it does that for you. I believe I had lupus since I was a child, but never been diagnosed until March 2021. To date, I see a cardiologist, a hematologist, a rheumatologist, nephrologist, and orthopedist. I'm hypersensitive with anything that's off with my body. Does anyone else feel hypersensitive? Absolutely. Absolutely. Like the hairs on my skin sometimes I feel things. It's like you can feel your hair grow, like your hair follicles will hurt. Like you can pull some of this hair and it will definitely hurt. I think that lupus makes us hypersensitive for everything, not only physical things, but mental health, spiritual, and all of that. So yes, if anybody else feels that, put it in the comments. And guys, please read through the comments and then answer some of the people that are on asking questions as well. I don't know everything. If I don't know it though, I'm gonna try and find it out for you. But it's always good to know that we're not alone, like she stated. And it's always good to know that people out there understand your fight. you know. Let's see. Newly diagnosed and feeling this burning skin pain, like when you come in from the cold. Not sure if it's lupus related, but super uncomfortable. It is lupus related. I hate to say it that quickly, but it is. That skin, that's that part of that hypersensitive. That skin can really be really agitated from inflammation, and you might not see it. You might not see the lesion, but you can feel it. And just make note of when that's happening so that you can tell your doctor and he can tell you if it's something more or if it's something that you don't really need to worry about. Thank you. Great session today. Good night, everyone. Be blessed. Good night. A rare diamond. Thank you for tuning in. I so appreciate you. What are your indications that you will having a bad flare? Mine will be the pain in my shoulder blades radiating in my nape, and it is like burning, and it is warm to touch. Some of mine are these vivid dreams. I've even written about it on different websites. Vivid dreams, like dreams that feel like they are real. I know when I'm having those vivid dreams, and I can wake up and tell you exactly what's going on in those dreams, and they're really crazy dreams, I know a flare is coming. Usually a couple of days later, a flare is there. Or the tingling at the tips of my fingers or the tips of my toes. Things like that really warn me that a flare is coming. Or if I eat something like a hamburger, I know a flare is coming. And we all do things that we shouldn't be doing as we deal with lupus. We're not robots. We're human. And things are going to happen. So, but yeah, those vivid dreams really, really make me know when there's a flare coming. Pretty Gam, thank you for coming in. Oh, I'm glad. Well, I'm glad that you tuned into your first live, and you have a great night as well. I'm going to scroll down and see what else we got here. If I don't answer you tonight, I will answer you later on. Oh, someone with the goat milk again. I'll put this up here so that you can refer to it later. I use a brand called Beekman 1802 goat milk soap and lotion. You can get it on their website or HSN. It's expensive, but they have deals all the time. My husband retired, so once I'm out of the Beekman 1802, I'm going to try to find a cheaper brand. Try that Yardley. Try that Yardley from the dollar store. Hi from the Philippines. Thank you for tuning in. Hi from Stockton. Thank you for tuning in. I appreciate you all. This is going to end our session for the day. If you have any more questions, you can definitely put it in this chat area or send me a private message. I'm always open to having a conversation. If you want to tell your story, let us know. Y'all keep Amber in your thoughts. And just, hold space for her, for everything to go well at home. Never associated dreams to flares. Yep. For me, those dreams to the flares, I know it's coming. I know it's coming. As soon as I have one of them weirdo dreams, I know it's coming. So thank you all for your questions. Thank you all for your comments. I so appreciate you all tuning in. I hope you guys are enjoying walking with us in the marathon. If you're not, come on with us and walk. I know we have some people that are walking with us and have already walked a marathon. So Jennifer said that she tried that Yardley soap and it was too drying. What did you use and like? I have not used any oatmeal soap. I usually use Aveeno body wash. And when I get the name in my head, I mix Aveeno body wash and an oil. I wash with that. And then I use the CeraVe and the Aquaphor healing ointment. That's what I use. And the cold showers usually take away the itch. So if you find that something is drying your skin, definitely don't use it. But I want to thank you all for tuning in. I so appreciate you all and having your questions. And I like this type of session. If you like it, give us a thumbs up and let us know. We'll do another one just like this. I so appreciate you all. Thank you for tuning in. And I hope you all have a great night. I will talk to you guys soon. Bye-bye.